All right, thank you, Nat. The sacrifices that they make enormous when it comes to the world combating the spread of COVID-19. We're talking about those healthcare workers. They are working tirelessly right now to control and treat this virus. Joining us now with a first-hand account of how hospitals are coping with the pandemic, Dr. Michael Warner, who's the medical director of critical care from Michael Garron Hospital. Good morning to you.
Good morning.
You joined us via phone for a number of reasons. We're trying to keep a lot of our guests by phone or Skype this morning, trying to practice what we preach, of course. So let's talk a little bit about what's going on with you and specifically at Michael Garron. How are you holding up?
I think the entire healthcare team is doing very well. We've been planning for this for weeks, and in some cases more than a month. COVID-19 is here. It's in the community. And we feel like things are just about to get started. But we're prepared, and preparations are ongoing every hour.
Let's talk about some of those preparations. We are looking at some visuals of people just lining up. There's a lot of questions when it comes to the assessment centers. Of course, there is one at Michael Garron. Can you give us a little bit of insight on how that's going?
So the assessment center is really not my area of expertise, being an ICU doctor, but I do know that we are one of the hospitals that has one, and that it's to some degree been oversubscribed. There are lots of people coming to be assessed, which is a great thing. It's been difficult to meet demand, but our team is doing its best. And as this progresses, more resources may be needed to screen as many people as is required.
Michael, there's a lot of questions when it comes to people even being able to be swabbed or having the supplies to be able to test people. Is that a concern for you?
The more people who are tested, the more information we have about this virus, how it's spreading, and the rate at which it's spreading. So testing is fundamental to getting a handle on this. Healthcare resources in general, though, are finite, and swabs, healthcare workers, ICU beds, ventilators, they will all come under strain if this progresses.
Are you hearing any direction from the province at all in additional funding or additional resources that are going to come into play?
At this point, we've been focusing mostly inward on our hospital and how we're going to manage this. There's lots of collaboration among hospitals. I haven't been part of any formal discussions with government officials on my end.
So, Michael, I think I want to be able to take this time to get people to really understand how serious this is, because you're hearing of people with mild to no symptoms and saying, I'll be fine, it's okay. But we really do need to take into consideration the general population and those who are vulnerable. So I'd like to put this in your hands to put that message out there.
So I'll be very clear and definitive. This is not a drill. This is real. This is happening. And it's not happening somewhere else. This is happening here. If you are young and you are healthy, you feel that you may not get sick, it doesn't matter. This is about the community. This is not about the individual. This is about collectivism. We all need to be in this together. Everybody, without exception. There's no wiggle room. It's clear that social distancing is mandatory. No play dates, no going to the playground, no going to the mall. Stay home. Shut everything down.
Michael, I really appreciate that message. And also, I want to thank you and all of the healthcare workers who are really doing whatever you can to combat this. Thank you.
My pleasure. Take care.
Thank you. All right. Very clear message there from the doctor, and one that we hope to continue on this morning. It is 7:36. Dina, Devo, we're going down to you.